So today, let's dive into the incredible story of Dow University of Health Sciences, or DUHS. And this one is fascinating because it's about how one single institution, founded even before its own country was born, grew into a powerhouse on the world's health stage. Let's trace that journey. At the very heart of this entire story is a simple but really powerful idea. Prevention is better than cure. And you've got to understand, this isn't just some catchy phrase they put on a wall. It is the guiding principle that's fueled this place for almost 80 years. And here's what's so wild about the timing. This place, which started as Dow Medical College, was planted like a single seed back in 1945. Get this, that's 2 full years before Pakistan's independence. It was born right on the edge of history, out of a desperate need for doctors in the region. So that's the big question, right? How did it go from one small college to a world-renowned university that's making a global impact? Well, to get that, we first have to understand just how big it's become today. Okay, first off, let's just take a moment to appreciate the sheer scale of what DUHS is right now. It isn't just a university, it's a genuine pillar of Pakistan's entire healthcare system. Just think about this number for a second. According to the QS World University Rankings, DUHS is in the top 600 universities on the planet for medicine. That tells you everything you need to know. This isn't just a regional player anymore. It has become a global force. And wow, this comparison just lays it all out. Back in 1945, it was Dow Medical College, tied to the University of Mumbai, with a tiny first class of only 45 students. Flash forward to today, it's a huge independent university with more than 20 different institutes, taking in thousands of students every year. The growth is just staggering. All right, so to understand how it got here, we have to rewind the clock. We've got to go back to that original seed, planted in the final years of the British Raj. You can really see the evolution right here on this timeline. It kicks off in 45 as a college. Then, after independence in 47, it logically shifts its affiliation to universities in Pakistan. But the real game changer? That comes in 2003. That's the moment it officially transforms into a full-blown university, which set the stage for the massive expansion we see now. And of course, institutions are all about people. You had the British governor, Sir Hugh Dow, who gave the college its name. You had key local figures like Dr. Wadhwani helping to plan it all. And then you had the pioneers like Miss Famida Shak, who was one of those very first 45 students to walk through the doors. Now, that moment in 2003, it really deserves a closer look. Because this wasn't just a name change, it was a total transformation that created the modern powerhouse we know today. So what was the big move? Well, it was a really strategic merger. The original Dow Medical College joined forces with other major local institutions, like Sindh Medical College and the famous Ojha Institute. This move brought together talent, resources, and infrastructure all under one powerful umbrella, DUHS. And becoming a university wasn't just about a new sign out front. It was about getting that crucial seal of approval. Nationally, it got recognized by all the important bodies, which cemented its status. But maybe even more important, getting listed in the World Directory of Medical Schools meant that a degree from DUHS was now a passport for its graduates to practice pretty much anywhere in the world. So if that 1945 college was the seed, well, the university today is this huge, thriving tree. And this tree has 3 really distinct, powerful branches that support its entire mission. And here they are: education, research, and healthcare. These are the 3 pillars of everything DUS does. This structure shows how it's gone way beyond just teaching doctors. Now, it's about creating brand new knowledge through research, and then delivering that expertise directly to patients through a massive healthcare network. I mean, just look at the education branch. Sure, it's still got the classic MBBS medical degree, of course, but look how much it's branched out. Now you've got dentistry, pharmacy, nursing, physical therapy, biotech, all the way up to PhDs. It's become a complete ecosystem for health science. And the research side? This is where things get real, fast. During the absolute height of the COVID-19 crisis, researchers at DUHS were right on the front lines. They developed a cutting-edge therapy using plasma from patients who had recovered. This wasn't some theoretical paper. This was a real-world solution developed in the middle of a global emergency. And finally, you have the healthcare branch. This is where all that top-notch education and cutting-edge research actually reaches the community. We're talking massive teaching hospitals, world-class specialty institutes for things like liver and chest diseases, and one of the largest diagnostic lab networks in the entire country. But you can talk about buildings and rankings all day. A university's real legacy, its true impact, is measured in the culture it creates, and most importantly, the people it sends out into the world. For me, this right here gets to the absolute soul of the university. This thing, the Patients' Welfare Association, was founded by students way back in 1979. It's a massive volunteer group that gives free medical care to people who can't afford it. That tells you that this spirit of service is just baked into the DNA of a DUHS education. And the proof is in the pudding, right? Just look at the people who have walked these halls. You've got founders of massive hospital networks, the former governor who actually signed the university into existence, a top cancer researcher at Columbia University in New York, and even trailblazers like Pushpa Kamari Kohli, who broke barriers to become Pakistan's first Hindu female police officer. The impact is just so diverse and so profound. So when you look at the whole story of DUHS, it leaves us with a much bigger question. It shows how an institution that was born from a local need, with this deep mission of service, can grow into a real global force. It kind of makes you think, maybe the true purpose of a university isn't just to teach students, but to lift up entire communities and, in the end, improve the health of the entire world.